So this is the Making a Plan program that the Wellness and West County Community Services is now going to implement in peer centers over at Wellness and Advocacy, and they're at Interlink also. And so today is an introduction for you at Interlink so that you know what this program is about. And, hopefully you can take advantage of it. Thank you for inviting me to do the presentation for Interlink's monthly forum. It's good to be with you. We think that you will find this very helpful. So here's an orientation of what we're going to talk about. As I said, it's a new program that West County Community Services is implementing in the peer centers. And we're going to look at the importance of advanced care planning. I'm going to introduce you to the Making a Plan Toolkit. We'll be talking about how to participate in this program at Interlink. And then my presentation is going to be about 20 minutes. And then after that, Sean will be making any comments that he wants to, and then we'll open it up to class discussion, and we'll end looking at the website that we're going to tell you about also. So before we begin, I'd like to tell you a little about the roots of this program. It grew out of a collaborative effort of those you see listed up here at a time when Goodwill operated the Peer Support Center serving Sonoma County. The need for the Making a Plan program, or MAP as we call it, was determined by the older adult team at the County Behavioral Health Division. They found there were no appropriate advanced care planning resources helpful for people living with mental health challenges served by OAT. From the older adult team pilot, the Making a Plan program grew and evolved to address the need by creating this Making a Plan Thinking Ahead toolkit and training we will be talking about today. For the past few years, the MAP program has been nurtured along thanks to peer community involvement and support, including West County Community Services. Peer centers that participated in creation of these new materials include those listed up here on the slide. Sean Kelson and Kate Roberge were instrumental in creating the Making a Plan toolkit. Their wisdom and shared experience are at the root of the Making a Plan toolkit. To me, that sparkles through the entire Making a Plan program, and I think you will agree as you learn more. So what is the Making a Plan program? It's a new advanced care planning program, as I said, that West County is implementing here at Interlink and also over at the Wellness and Advocacy Center. This program has trained peer staff to become Making a Plan facilitators, and those trained were Sean Kelson, Michael Reynolds, Danette Alandra, and Gracie McGowan over at the Wellness Center. The program is teaching peer center members why advanced care planning and making a plan matter. It's empowering center members to make care wishes known and to have their care wishes honored by doing advanced care planning using the Making a Plan toolkit. And it helps peers communicate with providers, family, and friends about things important that should be known if a person is unable to speak for themselves in a time of crisis. The MAP program recognizes that you are unique and that you know best about your treatment choices. And MAP considers what happens if you can't speak for yourself to direct your own care. We know healthcare professionals are trained to do everything possible to restore health, but it may not always be the care that you want. Advanced care planning using the Making a Plan toolkit can help you communicate your preferred treatment choices ahead of a crisis so your care wishes can be known and honored. Before we continue, I'd like you to briefly think about a couple of questions in silence, no discussion, as food for thought. These questions go to the heart of what we are talking about today and something that we all should consider. Imagine you're in a place you can't make decisions for yourself. Who will speak for you when you can't speak for yourself? So let's pause a few seconds and think about that. Now that you thought about who could speak for you, I would like you to contemplate this question too. We will again pause briefly to think about this in silence with no discussion. Doing this helps us to realize how important it is to think about this. So how would this person know what you want? Do those close to you and your care providers know your care treatment preferences? Making an advanced care plan requires us to think about what kind of care we want or do not want when seriously ill, incapacitated, or at life's end. Through advanced care planning, you can decide if you want someone to speak with your doctor and other healthcare providers if you can't speak for yourself. Say you had an accident, a stroke, a mental health crisis, or were seriously ill. The Making a Plan advanced care planning documents help you express your care wishes ahead of the crisis so others know how best to honor your wishes. The Making a Plan program is an advanced care planning program tailored specifically to the peer community. Decisions made are documented in the Making a Plan Advanced Directive. That becomes a legally binding document recognized by all healthcare professionals when witnessed and signed properly. In the Advanced Directive, you could also name someone you trust to express your choices and help guide your care when you are not able to do that for yourself. This person is called the healthcare agent. The goal of advanced care planning is that our treatment wishes are expressed, known, and honored when we can't direct our own care. This applies to both physical and mental health care. The Making a Plan Toolkit was created as a user-friendly way to do just that in the peer community. We are indeed the pioneers. So why advanced care planning matters? As I said before, it recognizes that you are the expert on what's right for you. It helps you get care you want, when it's needed, where you want, whenever possible. It empowers you to have a say in your care, even when unable to speak for yourself. And it helps others understand who and what really matter to you, if in a health crisis, including a mental health crisis. As we think about advanced care planning and consider the Making a Plan program, it's important to recognize that hope is not a plan. Aggressive treatment is the default when there is no advanced care plan in place or no one is legally can speak on your behalf. Healthcare professionals are trained to do all possible in a crisis when a person is unable to make their wishes known, and that's how it goes, like it or not. California law provides that any person 18 years and older is presumed to have capacity to make an advance directive. The law presumes that the patient and their healthcare agent or surrogate have capacity. The fact that a patient or their healthcare agent is going against medical advice or making a, quote, bad decision, end quote, does not indicate lack of capacity to make medical decisions. Capacity means that the person has the ability to understand what is being said or done and make their own decisions. Conserved people are presumed to have capacity unless it is determined otherwise. Now, this is looking at the Making a Plan Toolkit. So it includes a workbook that's very user-friendly, easy to read, gets us thinking about all the different things we need to consider before we actually go to the forms, which include the Advanced Healthcare Directive. On this slide shows us the table of contents for what is in the toolkit. So in the workbook itself, you see there's a whole lot of information to help think through all of this. About it talks about making your decisions. If you want to choose somebody who could help you go through the workbook and completing your forms, it talks about choosing a trusted helper who might help you. It talks about personal requests for care, so you can go through and think about your different choices, medical treatment choices, gives good information about how do we choose a healthcare agent, what do we want when we think about who could be the healthcare agent, and then it has other kinds of tips and information. In the forms booklet, that's where you find the advanced directive, which is a very simple, user-friendly directive. And also in the forms is a personal request form that has our wishes for care and our personal belongings. So anything from what happens to my pets, to my plants, does somebody let my employer know if I'm not able to express myself and be in touch with people, who's going to look after all these things if I'm not able to do that? So that's what in the personal request section. And then there's a mental health supportive care plan. And that plan is where we give guidance about what kind of care would we want if we're having a mental health crisis. And there's two versions. One has a checklist kind of approach, and the other is an open-ended questions approach. When we use these things together, these completed documents can help assure that a person receives the care they want, when they want it, where they want it, whenever possible, when they're not able to guide their own care. And Sean is the Making a Plan facilitator that's been trained now for Interlink, and he can help you learn more about this and how this all fits together if you have interest. So this is just a little excerpt out of the mental health supportive care plan, just to give you an idea of what kinds of things do we cover in there. So this, as I said, is letting us clarify our wishes for mental health care. And we then include this as part of our advanced directive. So we make this an attachment to our advanced directive, and then it's legally recognized by law as a part of our advanced directive. So you can see the things that it's looking at, like what might trigger a mental health crisis, what are early warning signs, what kinds of things could be difficult for me that would make the crisis worse, what helps ease my distress and give me comfort, what's the best way to approach me to offer help if I'm in a crisis. It talks about medications and treatment preferences and other things. So that's just a little glance at what's in there. And as I said, Sean here at the center can help you to learn more about this and actually complete your advanced directive using the Making a Plan materials if you are interested to do that. Time and again, I hear from people that doing advanced care planning gives them peace of mind. It takes away a lot of worry about the what ifs we wonder about, knowing it's just a matter of time. I know this to be true for me and my family too. With advanced care planning done, we can relax knowing others can step in to help when we need their help. Having made an advanced care plan and shared your plan with the people who will be in charge of your care in a crisis, you can relax. It's a good feeling knowing you have a team that will advocate for your healthcare choices when you can't do that for yourself. So if you'd like to learn more, you can make an appointment with Sean, who is now trained as a Making a Plan facilitator. You can visit the website caringcommunity.org and you can actually look at the toolkit, and there's videos up there that we've created to help orient people to all this as well. So with that, I'd like to open it up for, let me turn off the recording first, and then we'll open it up for Sean if he has anything that he would like to add in here. Let's see here, and then we'll have class discussion.